should women or even men bother about breast health? My name is Patience Ibaso Achiche. You're welcome to the Learn With Me series brought to you by Set 18 Oncology Nurses in Training, National Hospital, Abuja, Nigeria. It's our pleasure to always bring you information regarding cancer and the oncology space. Today we will be talking about breast cancer as well as breast cancer screening. And I won't be doing this alone. I have a colleague of mine who is very beautiful and always willing to share information. She is no other person but our very own distinguished Nurse Gladys. Nurse Gladys, you're welcome to the hall.
Thank you very much.
People know me here, but I don't think they know you, so it will be so kind of you to introduce yourself to us.
My name is Eki Gladys Oguntimere, and I'm here with my colleague, and today we're going to be treating the topic on breast health.
Thank you so much. When I thought of a topic to share with you, I looked at the society we are in today. There are a lot of beautiful women out there like you, like me, who are not even aware of what breast cancer is. We cannot overemphasize on this particular condition. So I would like you to kindly briefly tell us what breast cancer is.
Okay, breast cancer is a type of cancer. It affects the breast, it originates from the breast and can spread to various organs in the body.
Okay, that is cancer that affects just the breast.
Yes, and just from the breast can
Go to
invade other organs. Yes.
Okay, so how will someone out there know that he or she has breast cancer?
Okay, that's where breast cancer screening comes in. So we screen for breast cancer to be able to early detect breast cancer without any manifestation or signs and symptoms. So we try to be ahead of disease. So that is where breast cancer comes in.
Breast cancer screening.
Yes, breast cancer screening.
That's so beautiful. So we are trying to be ahead of the disease. What are the breast cancer screening methods available? Are there many, or there's just one particular type of screening method?
Okay, they are classified under 3 categories.
Okay.
We have the breast self-examination.
That's one.
We have the clinical breast examination, and then we have the imaging that includes your mammography, your breast ultrasound, and the likes.
Okay, so for you mentioned breast self-examination, you mean that is I can tell myself or I can detect that I have breast cancer? Is that what you mean?
Okay, the core concept of breast self-examination is for self-awareness.
Okay.
So yes, so you should know how your breast, I'm talking about the women, the men, you should know how your breast looks like. You should know the shape of your breast, right? And definitely you should be able to perform this exam every month. For the ladies, few days after your period, 5 to 7 days after your menstrual cycle, where your breast is no longer very sensitive. Yes, you would examine every month. Examine your breast, right? You do this in like a clockwise circular motion. I think you're going to.
Yes, I'm going to drop a link in the bio for them to watch how to carry out the breast self-examination.
Okay.
So when you say we should do the breast self-examination, is there any particular thing we should look out for when carrying out the breast self-examination?
Okay, yes, very well. You should be looking out for breast lumps,
Okay.
right? Shape of the breast, like I said, self-awareness, meaning you know what your breast shape looks like on a normal basis. You know what the size looks like. You know what the color of the breast looks like. So when there is a shift from normal, then you can further come to us, and then that's really goes to the next category, which is the clinical breast examination.
Okay.
Yeah, so this is where you come to us, trained healthcare personnel will then examine the breast to confirm whatever symptoms. Yeah.
Are you trying to say that once a clinical, a health professional carries out the clinical breast examination, you will just conclude that the person has
it
breast
still
cancer?
does not stop there. That is where we go to the very third category. The gold standard for breast examination is the mammography.
Okay.
Yes, so this particular procedure is where it's a very short procedure anyways, and there are lots of misconceptions about this procedure.
Please throw more light.
Yes, so it's a procedure whereby you go see your imaging specialist, right, and they place the breast in between 2 plates, and they compress it softly. So not so much, but there is a compression between 2 plates. So your breast is in between 2 plates, and there is a compression, and this will further help imaging. So imaging then they are taken vertically, horizontally, to clearly see if there is breast cancer or any other kind of breast abnormalities.
Okay. So
Yes.
there are a few misconceptions about breast mammography. What would you say to women who do not like to carry out breast mammography? Women who are scared of going for breast screening, most especially the mammography, because of the negative things they've heard about it.
Okay. First, I think it's okay for us to discuss what it is
Okay.
to the patient, because they already have this misconception. So at times it's better to see the patient and ask, what do you know about this procedure? So that will help, dictate where you should start the correction from.
Okay.
But like I have explained, it's not exactly an invasive procedure,
Okay.
right? So like I said, the breast is placed on top of a plate and then it's compressed to another plate so that imaging can be done to clearly see, what is wrong, if there's any abnormalities in the breast.
So is it true? One of the misconceptions. I was speaking to a patient in the hospital and I encouraged her to go for mammography. She said, lie, that if she goes, that her sister told her that they must tell her that she has breast cancer. Does it mean that everyone who goes for mammography comes back with the negative information?
Okay, now I think where that person was talking, but what that person was talking about, probably because they also say that they don't want to be exposed to radiation.
Okay.
But it will help you to know that mammograph, they use a very low dose
Right.
X-ray.
Okay.
Yes, very low dose
Right.
X-ray. Yeah, very
Okay.
low dose.
So it cannot affect the health.
No.
It doesn't cause another cancer.
No.
It doesn't cause you the breast cancer you are running away from.
no.
Okay.
It's a safe procedure.
Okay, so women from what age can do breast mammography? What is the age range? Should I talk to my younger sister and tell her to go do breast mammography?
Okay, so there are guidelines, anyways, that's
Okay.
guiding this particular information we want to share. So the Federal Ministry of Health is in support with the National Comprehensive Cancer Network guideline, and it states that all average risk women at the age of 40 should begin annual mammography screening.
Okay. So when we talk about average risk women, you're talking about those guidelines where you have the groupings of people that have categories of cancer.
There's high risk women and average risk women.
risk.
Yes.
Okay, we will do a video. In our next video, we'll be talking about the various categories of cancer groupings, the high risk and the average risk individual. Find where you belong by watching the next video. However, before we come to a conclusion, Ms. Gladys, thank you so much for the information so far. But I'd like to ask you, if someone discovered that he or she has a lump today, what would you advise the person to do?
Okay. Now, first thing first, you shouldn't be scared because your discovery is not a diagnosis.
Okay.
Right. So you would further have to go straight to the hospital, see your doctor, and continue further investigations.
Your discovery is not a diagnosis. Don't just sit down and conclude that you have breast cancer. It could just be something else. And finally, do you have any action words or motivational activities for the people for this week in regards to breast cancer and screening?
It is important to know that breast cancer does not only affect women, it also affects men. 1 out of 100 men is affected with breast cancer.
Wow.
And it's a health crisis in Nigeria. Currently, breast cancer is the leading cause of death in women in Nigeria. So I want to use this opportunity to appeal to the government, the non-governmental organizations, individuals to come together and make breast cancer screening accessible, free, even down to the primary health care level. Thank you.
Thank you so much, Ms. Gladys. I really appreciate it. Thank you for coming to share information with us. In case you're just joining us for the first time, this again is the Learn With Me series brought to you by Oncology Nurses in Training, National Hospital, Abuja. Join us every Monday and Thursday to learn something new about cancer. If you found this video helpful, please subscribe, like, share, comment, and drop whatever questions you have. We will always be on standby to attend to your questions. See you in our next video. Bye.